Close your eyes for a moment and imagine this. A 60-year-old man in rural Cameroon clutches his chest in pain. His village has no cardiologist. The nearest hospital is over 200 kilometers away. The roads are bad, and he has no means of transportation. Hours pass. His family watches helplessly, and eventually his heart stops. He dies, not because there was no cure, not because his condition was too advanced, but simply because he couldn't get a diagnosis in time. Sadly, this is not just one story. It's the reality for millions across Africa, every single day. Now imagine a different outcome. A nurse in that same village connects a patient to a small tablet device, takes a few readings, and in less than 10 minutes, a cardiologist in the city sends back a diagnosis and treatment plan. No hospital trip, no delay. Just fast, life-saving care. That's not a dream, that's the CardioPad. And that is the genius of Arthur Zang, a young Cameroonian who dared to ask, what if distance didn't have to kill? Today I'll take you through how this young engineer used technology to fight inequality in healthcare, build hope where there was none, and change the way we think about medicine in Africa. Africa is rich in human spirit, but poor in medical infrastructure. According to the World Health Organization, over 60% of Africans live in rural areas, yet more than 80% of specialized doctors are concentrated in cities. This disparity creates a life-threatening gap. People in villages often suffer and die from treatable conditions, simply because they can't access a diagnosis or medical advice in time. Take cardiovascular disease, for example. It's one of the leading causes of death globally, but in rural Africa, it's vastly underdiagnosed. Why? Because most clinics lack ECG machines, and even where machines are available, there are no trained specialists to interpret the results. Patients must travel long distances, sometimes days, to reach a hospital. These trips are expensive, physically draining, and often too late. This is the harsh reality Arthur Zang witnessed growing up in Cameroon. He realized that the real enemy wasn't just disease, it was distance, inequality, and the lack of adapted technology. Unlike in developed nations, where telemedicine is growing rapidly, rural Africa was being left behind. Arthur didn't have millions, he didn't have big labs, but he had an idea, a belief that technology, when adapted locally, could save lives. Arthur Zang, then a student at Polytechnic Yaoundé, took matters into his own hands. He learned medical basics on his own, collaborated with cardiologists, and spent years designing and testing a portable solution. That solution became the CardioPad, the first African-made medical tablet for remote heart diagnostics. Here's how it works. A nurse or healthcare worker in a rural area connects the CardioPad to a patient using sensors. The tablet records an electrocardiogram, ECG, and analyzes it in real time. It sends the data via mobile networks to a specialist, often hundreds of kilometers away. Within minutes, the doctor sends back a diagnosis and treatment advice. The innovation here is not just the device, it's the ecosystem Zang created. The CardioPad doesn't rely on stable electricity or high-speed internet. It's battery-powered, works on basic cellular networks, and is cost-effective. It's designed specifically for the African context. Moreover, Zang didn't sell out to a foreign company. He created Himor Medical Equipment, a Cameroonian company that manufactures the tablets locally. This helps reduce costs, create jobs, and boost national capacity in medical technology. It's innovation with independence. His work has received global acclaim, from the UNESCO Prize for Innovation to praise in Forbes and recognition in global health forums. But more importantly, it's transforming real lives in real communities. The CardioPad has already been deployed in several regions of Cameroon. In clinics where it's used, early diagnosis of heart conditions has increased dramatically. Patients who once waited weeks or months for a hospital trip now get results in hours. One rural clinic in the Northwest region reported that since using the CardioPad, they have seen a 50% reduction in cardiac-related emergency referrals. That means more lives saved, less hospital congestion, and better allocation of limited resources. But Arthur Zang's impact goes beyond numbers. He has become a symbol of African ingenuity, proof that Africa doesn't have to wait for Western solutions. It can design its own. Zang's success has inspired a new generation of African engineers, scientists, and entrepreneurs to focus on local problems using local tools. He has given lectures, mentored students, and promoted innovation contests across the continent. In a world that often underestimates African potential, Zang's story is a wake-up call. He shows that with the right mindset, even a student with no resources can revolutionize healthcare. Arthur Zang didn't just identify a problem, he created a solution that speaks directly to one of Africa's most urgent needs, bringing healthcare to the forgotten corners of the continent. Through the CardioPad, he has shown that technology, when rooted in empathy and adapted to local realities, can literally save lives. Think about the weight of his achievement. He helped close the gap between urban hospitals and rural communities. He developed a device that is portable, affordable, and locally produced. He proved that Africa can be a center of innovation, not just consumption. He empowered nurses, created jobs, and challenged an entire system to do better. Arthur Zang is more than an inventor. He is a symbol of what African youth can achieve when they combine knowledge with purpose. And if his story inspired you, don't let it stop here. If you believe stories like this deserve to be heard, if you want more videos that shine a light on the African heroes rewriting global history, then please subscribe to this channel, The History of the World. Your support helps us tell more untold stories, create better content, and inspire the next generation of change makers. Like the video, share your thoughts in the comments, and hit the notification bell so you don't miss the next journey into the minds shaping our world. Together, let's make sure that visionaries like Arthur Zang are never forgotten, but celebrated, studied, and multiplied. Thank you for watching, and stay curious.